So we're going to work on a 2-sample t-test for a difference in means. And this activity actually comes from Dr. Saver. And I'm like, can you have a better name as a doctor? Yes, he's going to save you. Anyways, and he happens to be the father of Mr. Young Saver, who helped put all these Skew the Script lessons together. So we can probably guess where this data comes from. Well, he was his dad, Dr. Saver, has been working on treatments for stroke patients. And what we're going to look at is the data that they gathered. But before we do that, let's go ahead and take a look at what we're trying to treat.
Stroke is injury to the brain from blockage or rupture of a blood vessel. And in the blockage type of stroke we studied, a clot lands in a brain artery, cuts off blood flow, and a region of the brain begins to die. If we can reopen that blocked artery, then we can restore the blood flow and save brain. In 1995, the drug TPA became the first treatment for stroke. It chemically dissolves clots, but in the next 20 years, no major advances occurred. And TPA is not at all a perfect drug. Even when you get it, less than 40% of people who have large vessel occlusions like this clot here in the brain artery are able to live independently after the stroke. So in this study, we tested a new potential treatment for these patients, a stent retriever. Stent retrievers are these mesh columns that are on a wire that's advanced through the leg artery all the way up to the brain artery, expanded into the clot. They capture the clot, and then you pull the stent and the clot out of the body and out of the brain, restoring blood flow to the threatened region.
So we look at these outcomes on this, and you want 0, no symptoms, and you want to avoid death. Death is the most severe of the symptoms of a stroke. So you can still walk. You might have noticed you had a stroke. If you have symptoms on the scale of 1 or 2 or 3, then you need help walking with this. So one thing to think about, why is random assignment important for this research? Well, let's say you got to choose. You're the person who had a stroke, or maybe it was your grandma who had a stroke, and you're in the family meeting and you're trying to decide, well, should we do the pill or should we do the pill and surgery? So first of all, they did 2 treatments. One is standard care, and the other one is standard care plus the stent. So why did they do that? Well, you want to treat the people if they've had a stroke. You don't want to just say, well, tough it out. You're our control group. That would not be so cool. So when the people came into the hospital, they were randomly assigned to either normal care, which is the basic care they should expect, or normal care plus the stent. And then, of course, the reason we're doing the research is we think the stent's going to help lower disability levels. So why do we need to randomize in the study? Well, if the patients got to choose, let's say you had just a mild stroke. Well, you'd probably just choose the pill because you're like, why do I want them to go through my leg up to my brain and poke around there and try and grab a blood clot, right? If you're feeling pretty good, and your disability level is low, you'd probably pick standard care, all right? Disability level, you'd pick standard care. The pill, all right? If your stroke is bad, you'd probably go for surgery. So one group, the first group, will naturally have a lower disability score, regardless of how well the treatments work, because people are like, oh, my stroke's okay, I can wait. So there are a lot of different things that you can look at. And those are just 2 reasons. It could also be money. For example, surgery is more expensive than a pill. So maybe you'd end up with just the poor patients on the pill and the rich patients with surgery. It all depends. So let's go ahead and go back to our activity now that I gave you that rough idea right there. And we're going to look at what method we're going to use. So they did gather their data, and we have a table right here. The mean disability for those who had the stent was 2.26 on a scale of 0 to 6. It was 3.23 for those who had the regular treatment, the control treatment. Standard deviation for both, shockingly, was the same. So the spread's about the same. And then the sample size, we have 98 patients that received the stent and 93 that got the control. So if the stents work, the reason we're going to do surgery is we're hoping to lower the average disability score. So we do see that it's lower. Could this difference have happened by chance alone? Or did the stent actually improve patient outcomes? So first of all, let's go ahead and write down our hypothesis in words. So we're going to say our current standard of care is best, or it's just as good as anything else. So there's no difference in disability levels for standard care or standard care with the stent, all right? So there's no difference. But we're trying to seek evidence to see if maybe we should change our mind. Maybe the stent is better. So our alternate hypothesis is that patients who get stents plus standard care have lower disability levels than just standard care. So that brings us to our sample again. And you notice here I have X bar. That's because that's for the sample. We know exactly what we got in our sample. And then here's our control group. So there's the stent group and the control group. And the X bar is there. And there's the standard deviation for each sample and the sample size. So now we're going to write these hypotheses we saw up here in a more mathematical way. And we're going to say mu S equals mu C. And what is that? Well, mu S, let me go ahead and define it since we're here. Mu of S, let me get my symbols. Be a little patient with me. Mu of S, all right? And maybe I'll just define one of them just so we don't spend forever on it. Is mean disability score. Oh, get out of there. Mean disability score for the stent for patients treated by the stent. All right, so they had the stent surgery. Mu of C is for your control group. So I'm just giving you an example. Ideally, I know this is regular stats, so you don't have to define as much, but it helps if you know what the things are. So which method are we using in our conditions met? We're going to do a t-test for difference in means. So we're going back to that student distribution that we were using for the means all along. But now we're comparing two means. And so we're still going to use that distribution. Was the sample random? Yes, treatments were randomly applied. And then large normal, do we have samples of at least size 30? Yes, the first one had a group of 98 patients, the second one had 93. So all conditions are met. Now, what you can do, and actually I'm going to go ahead and go to the staplet. You're going to go to the one quantitative variable staplet. So let me go ahead, one quantitative variable. Oh, I want to do multiple groups, not single groups, because I'm comparing two treatments. Now you might be, oh, we don't have the data. There's always a drop down here. You can go mean and standard deviation, and this is disability score. And we have the stent. And I think that was 2.26, but let me go double check. 2.26 and 3.23. All right. SD is 1.78, 98. Control group. This one was 3.23. And then here, this is still also 1.78, and this is 93. And you click on Begin Analysis, and right away it shows you Perform Inference. So the method we're using is a two-sample t-test. So we already had that up above. So if you look up here, a t-test for difference in means, see how we're doing a difference in means. Always use a 0 default to 0 to no on this. So we're not going to use conservative degrees of freedom there. So make sure that defaults to no. That's good. And then make sure it should match HA. So whatever you have here needs to match HA. If it doesn't, you're going to get the wrong answer. So let's go ahead. Our alternate hypothesis is that the difference was negative. We believe that 2.26, well, in the sample, we get a negative in our study. 2.26 minus 3.23 is negative, and we're kind of hoping that is a general case. So we're going to do 2 sample t-tests, and we want that to be negative. Perform inference, and there's your test statistic and your p-value. Don't forget, you can always change your decimals here. I like having 4 personally, and then I can hit done. If you change the settings, you can always go back and hit perform inference again. That didn't seem to change things. Let's double check. Yeah, oh well, it's interesting. So it's less than 0.001. Okay. In fact, somehow I got it to do more decimals before, so I know it's 0.0001. And there's our degrees of freedom. Where can you find that? Well, it'll be in your one quantitative variable. There's your degrees of freedom, and there's your test statistic, just like before. So we have a very low p-value here. So under my assumption that stents provide no added benefit, the actual observed data, 0.97 decline in disability in stent group, is highly unlikely. Our p-value is 0.0001. Well, because this is highly unlikely with my model, I reject my model, all right? I reject my earlier assumption. We have strong evidence that stent surgery lowers disability levels compared to standard care. And, in fact, so they actually stopped the study early, and we'll talk about that because they're like, oh, it's a big, well, it was pretty obvious one was better than the other. Well, how much better? If you want to know how much better, what you do is you can create a 95% confidence interval. And basically, if we go back to our Staplet and then just say 1 sample t interval, and you can keep it 95%, it pretty much lowers it anywhere from negative 1.5, or it lowers it by 1.5 to about 0.46, which is pretty decent. And we would say that's practically significant, all right? Because if you look at the original scale, it's not very big, you know? From 4 to 6, that's a difference of 2, and that's between needing help walking and death. So even moving 1 is a big deal here. And you can see our interval is anywhere from negative, lowering it by 0.46 to 1.5. So that's important. So the researchers, we'll talk about how people stop medical trials. Now, when in 2022, I think it was, they had a trial going on with Paxlovid, and they found that it lowered deaths by like 75% for people who got COVID, but they took it early on as symptoms came on. So they did the trial, they found out, oh my gosh, there's a big difference. And then they stopped the trial early. So sometimes you're going to see research trials are stopped early when we already have enough information to decide. So you're on the monitoring. So they stop it for 2 reasons. One, if you're hurting patients, good idea to stop. And then the other one, it's so good that we really need to get it out to everyone. So you were on the monitoring committee for a new drug that aims to lower cholesterol among men. Researchers aim to enroll 300 patients in the trial. Well, we've already got some data after the first 150. And so we have a test statistic of 1.587 and a p-value of 0.057. And there's our degrees of freedom. Would you stop this trial early? Why or why not? Well, our p-value right now is greater than alpha of 0.05, which is what we typically use. So we're going to fail to reject H0 or null. We don't have convincing evidence that the treatment lowers cholesterol. And in fact, if you run this, so let me go ahead, let's practice and create this. I'm going to steal this away so we can come up here. So we're doing cholesterol, okay, and we have control. Oh, let's edit. So the first group I have is control. The mean level is 209. Standard deviation is 53.75. Then we have the new treatment that we're trying out, and that's 195 with a standard deviation of 55 and a sample size of 75. So we hit begin analysis, and we can say, let's do a test, and we think that the treatment should have a lower cholesterol level, not a higher, and we perform inference. Oops, must have done it in the wrong way. mu1 minus mu2. Oh, I want that to be positive. No wonder. By the way, anytime you get a really big p-value, odds are you got confused on your alternate hypothesis. It's probably the other direction. So I think the cholesterol level should be higher on the control than the treatment if, for my alternate assumption, for my alternate hypothesis, not my assumption. I'm getting data because I think the treatment works. And when I perform the inference, you can see I get a p-value of 0.057. Well, that's not that impressive. So we're like, we failed to reject, which we already talked about. Then we can also say, well, what kind of difference did it make? When you want to know the difference it makes, you do an interval. 95% is as good as anything, so we do that. And we can see that generally it looks like it lowers anywhere from -3, so it actually raised it 3 points, to lowering it by 31 points. So we're not so sure this thing really works because 0 here is a plausible value. All right, and we can write our interpretation here. We are 90% confident that the true average difference in cholesterol levels between control and treatment groups is between -0.599 and 28.59 points. Now, let me see. Oh, this is a 90%. I have 95. It's like, why does my value not match? Because I don't have the same confidence level. There it is. Perform inference, and there you go. Now I match. And all is good. And that's pretty much all we are doing today. And I hope you enjoyed that lesson.